Ladies and gentlemen, colleagues, thank you for coming to our infection control webinar. Or is it a series of webinars? Sometimes I have so many things going on my plate, I tend to forget. But this evening I've been given the task to speak to you with regarding to hand and body hygiene. I hope this information will just be a precursor or a reinforcement to what you already know, because I'm sure all healthcare personnel probably by now tired of hearing about hand hygiene, universal precaution this, standard precautions that, isolation this, and sometimes the information can get rather overwhelming. But never mind. As Miss Walker said, I am Carlene Simpson. I've been a nurse for over 23 years. And so I hope I have gained the expertise so I could speak to you today. Okay, so basically, we cannot emphasize hand and body hygiene any more than or no more than we probably have been doing, especially in this COVID era. However, it is important because it's not only for healthcare workers now to be very adamant with regards to hand and body hygiene in this time. It's for everybody, the general public at large. And so if we are hoping to quell this pandemic, a lot of this information that I'll be looking at today will be very pertinent to all of us in the healthcare sector. So, according to the World Health Organization, hand hygiene is very much so important, especially to prevent the spread of the SARS-CoV-2 virus, which is the virus that actually causes the COVID-19 disease, and also other various infections, airborne, droplet spread, any kind of condition that you really need to be adamant with regards to contamination and not transferring microorganisms. We need to be very I'm looking for the phrase that I want to bring across the importance of this. So during circumstances that present a threat to public health, it is important that nurses bring across a global adherence, and it should also be a part of our professional code of conduct that we model to the public and to our peers the important behaviors such as hand hygiene, body hygiene. You will hear others speak about protective gear, and then of course we need to demonstrate these initiatives so that we can display the evidence, because there's a lot of research out there that is saying if we adhere to these best practice guidelines, what we know as best practice guidelines or evidence-based guidelines, that PPE, if done and done properly, does work. Hand washing helps to eliminate as much as 90% of infections that can be transferred or that can be contracted from one person to another or from one place to another by surface touching, direct contact, and so forth and so on. So in healthcare, the effective use of hygiene can very much so help to prevent the spread of what now is being talked about globally. It was here before, but because of what we are encountering as a region, as an international body, we hear about healthcare associated infections. And so, even though as nurses, we all have been hearing a lot about hand hygiene, wash your hands, sanitize your hands, do this, do that. From Florence Nightingale days, we've been hearing about hand hygiene. And we do sometimes think that we are practicing that initiative effectively. However, studies have shown that healthcare associated infections are still on the rise, and a lot of it is due to improper hand hygiene. So today we'll be looking at some little areas. I'm trying to show you my objectives. Okay, so I will just be doing an overview to set the scene of how we can advocate good hand hygiene. What are some of the causes of HCAIs, healthcare associated infections, how it affects the patient, how it affects us, the healthcare worker, how it affects the healthcare system. And we'll be reviewing what good hand hygiene is, the various methods, and of course, the 5 moments of hand hygiene. It's an initiative now being implemented across the globe by the World Health Organization. It has been in circulation since 2009. However, I'm not sure how many persons have actually heard about it via this title, because we as nurses, of course, we know the moments in which it is very important for us to wash our hands and to apply any form of hand hygiene so we can prevent the spread of microorganisms. And then we'll be looking briefly at, of course, body hygiene, in that we as healthcare workers sometimes might drop the ball because of various situations. But I must say, Sigma and we here at Omega Kappa are very committed to enforcing and educating and also advocating for these initiatives that will help us to improve our healthcare system and to decrease and prevent healthcare associated infections. And so briefly, I'll look at what is hand hygiene. So hand hygiene, as we already know, is the proper cleaning of your hands with whether soap and water and alcohol-based hand rub, which we affectionately call hand sanitizers, and of course, the use of sanitizing towels to remove germs and any kind of organisms from your hands in order to prevent the spread of microorganisms. So I'm thinking with regards to a study that I recently read. The study was done in a Canadian province, and basically it was looking at the various healthcare sectors and the how effectively hand hygiene is being utilized and demonstrated. And I am not going to tell you which of the bars on the chart belong to the nurses group. However, if you can take a guess as to where we would be on that scale with regards to how effectively we practice proper hand hygiene and how efficiently we prevent the spread of healthcare associated infections. So I hope you have picked one of the bars already, whether it be the blue one or the red one or the green one or the purple one. However, let me moving along. So in that study, actually, healthcare providers, mainly nurses, fall within the 40% tile of those whose hand hygiene compliance was less than up to par. So we are still down there. And I know we probably will be facing the same kind of statistics in Jamaica because we have different challenges, limitations that actually will prevent compliance on every level, at every scale, all the time to proper hand hygiene practices. Because sometimes resources are short. Sometimes the nurse is so busy moving from one task to another that the hand hygiene that she does practice probably may not be as effective as she thought. And of course, sometimes even the bare necessity of we do not have any water. And so we have to succumb to using hand sanitizer, which can only be effective at some stages. I will highlight that as we go along in the presentation. And so we are practicing, but how effective are our strategies? How much time do we really have, even as nurses, to pay adequate attention and to ensure that this aspect of our responsibility is taken care of efficiently and effectively? And so I'm looking at a worldwide report from WHO that states that across the globe, over 1.4 million persons are suffering from healthcare associated infections. And even in our modern healthcare facilities, we find that between 5 to 10% of individuals within a 3 to 4 day span of being in the institution has been tested and has shown that they have acquired a healthcare associated infection. And sometimes the frequency of these infections vary because in this same report, WHO stated that urinary tract infections are 34%, surgical site infections 17%, and of course there are the respiratory tract infections. And most time these infections are caused by if your patient is on a mechanical ventilator, when we are doing an aspiration procedure, when we are inserting an NG tube, and of course with your UTIs, when you're putting in a catheter or improper technique, when we're actually doing perineal care, and of course not maintaining a sterile field or improper site preparation if you're looking at surgical site infections. So a lot of times we have to be mindful of these things and not just wanting to get the task done, but how effectively and how efficiently is our care and is our precautionary measures in order to prevent healthcare associated infections. Because 50%, 50 to 60% of healthcare associated infections can be prevented through proper hand washing. And so the impact that can we can have, or our patients may experience, or even us, the healthcare worker, can experience from contracting a healthcare associated infections through improper hand hygiene is that our patient might get even more ill. Their stay in the hospital might be longer, which will be a financial burden to them and will probably be a financial burden to the institution. Complications might arise, or patients might develop um, long-term disabilities. And even us as nurses, we might find where we are not even aware in the initial stage that we actually contracted a healthcare associated infection. And then, God forbid, we pass it on to our families. We in turn might suffer serious long term illnesses. And so, in order to prevent the impact of these transmitted infections, hand hygiene, I cannot stress anymore that it is rather so important and needs to be looked at, where we implement these strategies in a way as to enforce. So when your nurse comes into the setting and thinks about caring for patients, she'll be always adamant and always mindful of hand hygiene practices. Okay, so 5 stages of hand transmission, we all already know because we all have done microbiology and, of course, health care, safety, and patient safety with regards to precautions. However, I am just going to just touch a little bit, just as a reminder, on this topic. So I think this is general knowledge now. I'm not going to even say that research has proven this, because it is general knowledge that hands are the most common vehicles to transmitting any kind of microorganisms or pathogens. And transmission of healthcare associated microorganisms from patient to patient, or from patient surfaces to patient via the healthcare worker, or from the healthcare worker to a healthcare worker, or from healthcare worker to patient. And so we need to remember that microorganisms, it's a normal body mechanism. Microorganisms present on the patient's skin and in the patient's immediate surroundings. They are transferable by hand from the healthcare worker, and whether it be to a surface or to another individual, those microorganisms can survive for up to minutes and hours on that individual's hand, or if transferred on a surface. And suboptimal cleaning, or even suboptimal cleaning of the hands, can create contamination just the same, because it is improperly and inadequately done. So when contaminated hands transfer microorganisms that cause diseases, hence we have a spread, we have infections here or there. I'm not going to say everywhere, because the purpose for this particular seminar is to highlight infection control and how effectively we can elevate the standards of some of what we do with regards to hand hygiene and preventing infections in ourselves, and in our patients. I remember doing a study when I was at the Spanish Town Hospital in 2017, and we actually swabbed nurses' notes. We were looking mainly at electronic devices, and in one individual's or on one healthcare worker's device, there were about 6 different pathogens found. And so we have to be careful how we wash our hands. Are we adhering to the evidence-based and the best practice technique that gives us 90% or more efficiency? Do we go about using our electronic devices, touching surfaces, even with the use of the protective gears? We can even not be so vigilant and be transferring microorganisms. So WHO again, because right now, I'm going to say universally, WHO has relaunched their patient safety initiative. And this initiative actually was founded in 2005 and disseminated. It was first called, let me see if I'm getting this, the WHO Patient Safety Challenge. Clean care is safer care. However, because of not too much buying from nations, because it was a worldwide initiative, and because the healthcare associated infection statistics did not reduce in the time frame, because they looked at it from a 1 year period with the countries that had signed on and that had agreed to implement the challenge within their healthcare sector. And they looked at it again when it got to 2 years. And so it showed that the infections were reducing, yes, but not by a very significant margin. And so in 2009, an extension of that mandate was sent out by WHO, where they launched the WHO Patient Safety Save Life Clean Hands, Clean Your Hands initiative. And I'm sure a lot of you have heard about this such initiative because it's very much ongoing. It's global, it's regional. There are modules, resources, the entire package out there. And I'm going to show you some of the resources as much near to the ending of the presentation, so you can see the resources that WHO is giving our healthcare system, and in turn us as healthcare workers, how we can promote, how we can enforce and improve techniques, one such being quality hand care, effective hand hygiene in our healthcare facilities, so that we can reduce the spread of healthcare associated infections. And of course, it will not be so much of a financial burden and of a physiological and psychological burden too on our healthcare facilities. So every healthcare facility in the world is having such a problem and would very much like to solve this problem. So we as healthcare workers have a responsibility to facilitate that, and of course we have our task cut out for us. So why do we need to learn about and practice hand hygiene? So of course, as I iterated before, hand hygiene is the most important way to prevent the spread of germs. If done properly, it is greater than 90% effective. And of course, 50-70%, because I know I said 50 to 60 before. This is another study I'm looking at now because WHO do a lot of research studies on this particular initiative. And sometimes when reports are published, it's published under the auspices of WHO, and you're not too sure exactly where or exactly which area or who the information is coming from. So up to 50-70% of healthcare associated infections are preventable. So using proper hand hygiene will prevent contamination from of patients' surroundings, the healthcare worker, and even our surroundings as well. So who should practice hand hygiene? When I saw this question first, I didn't read the back the backdrop below. I said everybody. So I didn't even see the everyone that is on your slide above the image of the healthcare workers. So everyone should practice proper hand hygiene. It's important for our health, it's important for our economy, and it's important for the high quality standard healthcare service and systems that we work to put in place. So hand hygiene is important not only for the healthcare provider, but for everyone who has hands, especially in this COVID era. We are hearing wash your hands, social distancing, wear your mask. So a lot of standard precautions to prevent the transfer of microorganisms is being emphasized today, more so hand hygiene in the healthcare setting. And it is more so important for the health worker to prevent contamination and the spread of infections in our healthcare setting. So, where do we perform hand hygiene? So, our hand hygiene is performed everywhere, should be performed everywhere in our homes, in our schools, outdoors, our businesses, and more so important in our healthcare settings, in every sector of our healthcare settings. So, not because I have acute care, or long term care facility, or community care on my slide as example, every single sector in the healthcare facility, we need to be performing proper hand hygiene. So, of course, because our healthcare sector is more prevalent to infections and the transfer of microorganisms that causes infections and diseases, the emphasis is placed on us more to be doing it properly and to be educating persons and ensuring that other individuals outside of our sector and among ourselves are doing it properly. So I'm going to look at the 5 moments of the hand hygiene approach that I mentioned, and you will be like, oh, that's what they call that. So, of course, your 5 moments would be according to WHO and their Clean Hands Save Lives initiative: before touching the patient, before clean aseptic procedures, before a clean or an aseptic procedure. And so, those number 1 and 2, moment 1 and 2, are for before you do things. However, I've seen adjustments to the initiative where number 1, moment 1 says before touching the patient or before touching anything in the patient's surrounding. And then, of course, 3 would be after body fluid exposure and risk for exposure to body fluids, and after touching the patient and after touching the patient's surroundings. So the other slides are just basically examples of the moments in before you touch the patient and the patient's surroundings. So before shaking hands, before entering the patient's room, before taking vital signs, before touching the patient, whether to assist with turning them in bed, assisting them to the bathroom, ambulation, you name it, we know the activities as healthcare workers that we do have to perform that requires direct contact. So, and of course, before any aseptic or clean procedure. So you practice thorough hand hygiene before handling any sterile dressing or any dressing for that matter, or touching any open wound or performing any invasive procedures. And then, of course, you also look at the after moments. And it's basically after you have done all those things that you did before. So after you have touched a patient, after you have touched a patient's surroundings, after you have made contact or was at risk for getting blood or body fluids on your hands, after contact with contaminated items, after coughing or blowing your nose, even if it's in a tissue or in your sleeve, after performing invasive procedures, and of course, after removal of gloves. So sometimes the healthcare worker might think because they had on a pair of gloves, especially sterile gloves, when they doff them, they don't need to meticulously wash their hands. Well, I'm here to tell you that's not the case, because gloves are prone to breakage, and sometimes it might even be a little pin head break, and your hand is exposed to blood or body fluids or is soiled and you are not readily aware of it. So even after removal of your gloves, meticulous hand hygiene is recommended. So moments 4 and 5 is after you have touched the patient and after you have touched the patient's surroundings. So clean hands immediately after any exposure to blood or body fluids, and even after you have touched surfaces that from looking at it, you think it is clean. So you probably might think there is nothing much to worry about. But always keep in mind, always remember that hand hygiene prevents the contamination and the carrying of microorganisms on your hands, whether into or out of the patient setting or into and out of the healthcare worker setting. Because mind you, hand hygiene is not only to protect the patient, it's also to protect us. Okay, so how to perform hand hygiene? And I know most, if not all of us, probably can repeat the steps to washing your hands with soap and water in your sleep. But it's hand hygiene here. I'm going to be looking at 3 techniques. And one is utilizing alcohol-based hand rubs, using old-fashioned soap and water, and of course, if in the event there is no water available, especially for visibly soiled hands, you will be using sanitation towels and the alcohol-based hand sanitizer. So we are responsible for, and I mean we healthcare workers, we are responsible for familiarizing ourselves to the proper hand hygiene techniques. Every healthcare institution, I think, have one. Whenever I go into the hospitals, I see the hand hygiene posters posted in strategic locations to remind us that we need to properly wash our hands. So WHO and also one of our best practice organizations, Registered Nurses Association of Ontario. And I like to look at some of the work that the Northern Ireland Public Health Agency does. And when I looked at some of the things regarding to hand hygiene, all three institutions, they emphasized incorporating hand washing guidelines into practice from even as early as orientation of new staff members. And of course, they also emphasized reporting defects in hand hygiene facilities to administrators, which nurse managers would be in that, will probably carry that title. And of course, the manager in charge of a unit where we are nurses now, so we're using the nursing administrator. She has the responsibility to always ensure that adequate resources in the clinical setting is available for proper hand hygiene practices, that infrastructure such as sinks and pipes should be retrofitted and in place so that healthcare workers can efficiently carry out this task. And uh, if I may say, sometimes when we go into institutions, we will not actually see the retrofitted infrastructure that I talk about, where still you touching the tap to, so the flow of water will begin, and then we have to touch it again to turn it off. And it's like we're trying to practice proper hand hygiene, but in the same breath, contaminating our hands all over again. So these organizations emphasized that sinks should have an overflow or a plug that would regularly be cleaned. And of course, hand washing sinks should either be foot operated or motion censored, or even though these are going out of style, even elbow operated devices. And so, even to ensure proper hand hygiene, as I said before, posters should be put out, remedial workshops for training, audits, have the nurses do audits to ensure that proper hand care is being carried out and the hygiene practices, and then healthcare workers are in adherence with the hygiene practices. So I will not be going through the entire technique as to how one should use alcohol-based rubs, but I found an interesting note from the Northern Ireland report that I was reading, and it says that alcohol-based rubs is the recommended method of hand hygiene in many healthcare facilities. And even without thinking of where the effectiveness starts and where it begins, nurses are ever so busy. And rubbing your hand with hand sanitizer for a 20-second might be the most time efficient way of cleaning your hands, but it is not effective in all respects. So the little note that I said I found interesting was that the Public Health Agency of Northern Ireland was saying that alcohol-based hand rubs should be at least 60% ethyl alcohol or ethanol, which should be equal to 120% proof. Like when we say right over proof from, yes. So ethanol, the ethanol property should be 120 proof. And when you compare it to a bottle of vodka, it is more stronger because a bottle of vodka only carry a 80% proof. So even in this pandemic, if you run out of water and you run out of everything else, you can't even use vodka if you might have it to clean your hands, because the efficiency will not, it will not give you the efficiency that you need. And so it is more effective to wash your hands with soap and water. So this slide is just basically showing us the various techniques when applying hand sanitizer or hand rubs for cleaning your hands. So you apply, some people say a palmful or 3 to 4 mils of hand sanitizer to the palm of your hands. Rub the product into your hands, palm to palm, then rub interlace fingertips, and then you rub fingertips of each hand in the opposite palm, between the fingers, rub each thumb clasp in opposite hand, then rub back of each hand with opposite palm, rub hands until dry before performing any other task. And of course, you do not wipe the hand sanitizer off your hand. You allow it to dry on your hand. And that is how it will effectively kill the microorganisms that might possibly be on your hands. And of course, hand sanitizers are recommended when there is no possible visible soilage on your hand. However, you had done one of those or undergone one of those moments that we had looked at before. And so there's a probability that you came in contact with microorganisms that you cannot see. However, if in doubt, always wash your hands with soap and water. So soap and water is the most highly recommended method for proper hand hygiene. So plain soap is used, which may have hypoallergenic or antibacterial properties. And these are mainly utilized in the healthcare setting. I will post the link where you can receive the poster and step-by-step instructions of how to properly wash your hands in the event you forgot. But then I hope that no nurse forgets the step-by-step technique and why it is important for you to carry it out in that manner. And so we also look at when your hands are visibly soiled and there is no water available. So moist antimicrobial or antiseptic towelettes can be utilized, and sometimes you will need to utilize more than one. because I would say it's one per hand. And if your soilage is visible, then perform it over again until you're satisfied that your hand is properly cleaned. And so after using the antiseptic towelettes, follow up by performing the hand rub technique, and that should count for some amount of efficiency with regarding to proper hand hygiene. So I'm moving forward because I'm running out of time. And so, of course, hand hygiene as well. We need to be mindful of the importance even when we are using gloves. And wearing gloves, we might not know poses a significant risk factor because it tends to allow us that comfort with regards to not paying so much attention to the time spent and the effectiveness of our hand hygiene techniques. And so it causes a significant risk factor for poor hand hygiene and for germ transmission. And even with wearing gloves, yes, those three institutions, I'm coming back to the WHO and the RANO and the Public Health Agency of Northern Ireland's initiative again, where healthcare workers' hands will more so help to reduce the spread of microorganisms, even if glove use is indicated. So WHO went even further to put a glove pyramid leaflet together, and that link that you're looking at is will take you to the glove pyramid leaflet, and it's an aid to decision making as to when to wear or not to wear gloves. So gloves must be worn according to standard and contact precautions. So the pyramid gives you a detailed look at some of the clinical examples, and they will also indicate to you and others in, okay, let me ensure that this point that I'm bringing is coming across clear. So the leaflet, read the glove use pyramid, will help you to make a decision with regards to your use of gloves, whether in standard or contact precautions. The pyramid details some clinical examples in which gloves are not to be, can not be used, and where it must be used, especially if it's in a aseptic environment, and especially when you're going to be exposed to blood or body fluids. And of course, hand hygiene should be performed appropriately before and after the utilization of gloves. Okay, so I hope I'll be posting the links in the chat, and I hope you will take advantage of the information, print them, take them to your clinical work area. If your nurse managers will permit, or if you're a nurse manager, you can decide whether you want to post these things or ensure that they're disseminated to your staff members so that they will be efficiently and effectively or sufficiently too informed. So even with looking at washing your hands, sanitizing your hands, we also have to be mindful of other skincare behaviors as well. So have you ever noticed the constant washing and sanitizing of your hands dries your hands out? So using hand creams to moisturize our hands regularly is important, because we're not only looking at just washing of hands or cleaning practices, we're also looking at other hand hygiene practices. So moisturizing your hands will prevent your skin from breaking down. It will protect the outer layer of your skin, hence preventing any sort of breakage on your hands, which will make one even more susceptible to contracting microorganisms through breakages in their skin. So if and when an individual finds that they have a skin lesion, same should be covered and they should seek medical attention. So skin lesions, if any, whether due to a chronic skin condition such as eczema or psoriasis, or any other skin problems associated with hand hygiene, they should seek medical attention. And staff with skin condition are very much, again, I will repeat, at risk for colonization of microorganisms, and even more so prevalent to spreading microorganisms, whether on surfaces or to other individuals. Cuts and abrasions on the hand must be covered with an impermeable dressing when in the clinical surrounding and when performing any kind of clinical procedure. So also, even with wearing jewelry, keeping your nails short, avoid any artificial nails, any wearing of nail varnishes or nail polishes on your hand as health professionals is, I would say, a no-no, or it is key methods into keeping you safe and to not having you be at risk for transmitting microorganisms on your hands, because it is less likely and more efficient to clean your nails when they are short. You're at higher risk to have microorganisms being trapped under the bed of your nails or even in the cracked areas of your nails when you have long nails. Artificial nails, nail polish, nail varnishes will pose the same problem, where if they're cracked, they are a source for trapping microorganisms, which will be more readily spread to surfaces to other individuals, such as our patients and even our very co-workers and our family members. I am trying to touch on every little area. So even for us who are out in the community. So I found a little excerpt that says support the person you are providing care to and attending to their own hygiene. So not only in the healthcare setting, because hand hygiene is also important in the home setting, and especially for community healthcare workers when they're in their community healthcare setting or they're in a healthcare home visit kind of setting. So in most instances, those category of healthcare workers will be providing healthcare services in the home setting, and sometimes it may be necessary for them to take their own hand cleaning resources because they might not be available, especially if you probably go into somebody's home. And taking your own will be so much more efficient because at least you know what's best for you to use and you're responsible to ensure that you effectively carry out your hand hygiene techniques. So your visitors, your patients, teach them. They can also be aware of how the spread of these infections can be stopped. And teach your patients. Hands should be washed after using a bathroom or toilet facilities, before eating, after you cough or sneeze into your hand or into your elbow or even into a tissue or a towelette or a rag, because sometimes the force of the droplet spread is so much that sometimes you get even a little bit on your hands when you were, of course, trying to avoid it. So even after touching pets, touching dirty areas, a lot of persons think because they're home, everything is safe. And so proper hand hygiene should be emphasized in the healthcare and the home settings. Visitors themselves should be taught, and patients too, how to effectively wash their hands and how to effectively use other techniques of proper hand hygiene. And so whenever you come in contact with somebody and you notice that the hand hygiene practices is very infrequent, even out there in your community, it's our responsibility as healthcare workers to encourage them. Show them how to properly wash their hands. Show them the techniques for hand washing with soap and water, no less than 45 minutes. For using the foams and the hand sanitizers, rub for 20 to 30 seconds. Do not wipe off the hands. Allow it to dry on the hands. Educate them why the way you are teaching it to them is more so effective, because it readily kills the germs and will prevent the transmission, which is what we want. So there was a study, I think it's the Public Health Agency, Northern Ireland study, that saw that hand hygiene was not being done. It was being done, but not as effectively, because nurses are always busy. When you continuously do a routine, sometimes you are not all that thorough because of the repetition of the routine. You just do it without even paying much attention to the effectiveness. And so washing our hands sometimes might take less than 40 to 60 seconds. Putting hand sanitizers on our hands might not even take 10 seconds. It might not even get to the inner creases of our hands. We will just give you an example. Went to a store the other day. The security guard proceeded to sanitize my hand. God bless the little bit sanitizer he put in my hand. And I was there looking at him and he was looking at me, and I'm like, this will not be able to clean my hand as effectively as you probably would like me to do it. So he put a little bit more. Still didn't reach the sufficient amount. So we had to do it again because I actually left my car and I was going into the facility and I did not clean my hands before. And so I wanted to ensure that my hands were actually clean. So sometimes we don't even apply as much to our hands. so it can effectively cover all the areas that we really need to cover. And sometimes the sanitizers are not even alcohol based either. So that even reduces the efficiency and the effectiveness of what we are using to clean our hands. So compliance with hand hygiene is very, 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 very important. And so some of the main reasons that, as I said before, were reported was because we're using the gloves, we're too busy, so forth and so on, and hand hygiene does not get the priority that it really do needs. So with hand hygiene, we will look at body hygiene as well. And when we consider body hygiene from a personal perspective, it can take a wide range of areas, from skin care to foot care to ear, eye care, dental care, perineal care. And though it is vital that every healthcare worker meticulously attends to his or her own personal hygiene and even hygiene areas in their work setting, I am just only going to focus on those areas that constitute regulations and protocols in the healthcare work setting. So, in the same way that we consider hand hygiene, we need to consider body hygiene equally important. So, body hygiene among healthcare workers can also aid in the transmission of healthcare associated infection. So, one doctor, Alison Ross, from the National Institute of Health in the USA, she did a study showing that nurses are knowledgeable regarding to the importance of health promotion activities. And nurses, however, nurses will not follow some recommended guidelines to self-care. Strict hygiene routine were examples that she gave: physical activity, proper nutrition, adequate sleep. So sometimes we will ensure that that happens for our patients, but we don't ensure that the same thing happens for ourselves. And you know what I'm talking about with regards to dropping the ball when our self-care needs to be looked at and should be of utmost importance. So she stated that due to long hours of work, workload, shift associated activities in nursing practice, family, social life, and sometimes academic life too, the nurse might be so stressed and she might be so vigilant in wanting to do her best in her healthcare situations that the right amount of attention sometimes is not being paid to areas that speaks to body hygiene. So one recommendation that she made in her study was to suggest that nurse leaders should incorporate strategies into the nursing workplace to improve health of the staff nurses and the other healthcare workers, to increase health promoting behaviors. And I am sure when I read the article, I'm saying, but these are regulations in our healthcare facilities already, where we do continuous and hygiene campaigns, remedial training on how to effectively use protective gear, donning, doffing, and of course, your attire and your grooming for work, your adherence to the uniform regulations, your adherence to the kind of jewelry that should be worn, footwear, and of course, we also will be looking a little bit at food care and decontamination techniques in the event that we ever should encounter such situations in which a decontamination is required. So, according to Dr. Halier, Dr. Halier is a medical endologist. He stated that Nightingale, Florence Nightingale, he means no, as long as in the 1860s, called on nurses to wash their hands and their faces frequently throughout the day, reflecting a long-standing recognition of the effectiveness of body and hand hygiene. And this statement was also backed up by Northern Ireland Public Health Agency, where they expounded on this statement and they recommended that health workers should bathe daily. And when I read that, I'm like, which here in Jamaica in a tropical climate where we sweat so much and where sometimes we are so hot we just want to immerse ourselves in water, will somebody not take or pay special attention to a daily bath? So they further went on to say, when working long and tedious hours, personal hygiene can be delayed somewhat. So it was recommended that at least every 8 hours, the healthcare worker needs to have a bath and a change of clothing, especially if working in a highly contaminated area, and especially if working extended periods like you're on call or overtime or you're working overtime. And of course, I've seen healthcare workers practicing, they might have seen the study, practicing such recommendations in the healthcare setting. You might not see it as much because most healthcare workers are just doing like the 4 hour and the 8 hour shifts in order to limit the amount of time spent in the clinical setting, especially when they're working in highly contaminated areas. And so it was also recommended that even with sweating, bathing is important because, as I was saying, we're in a tropical climate and we sweat. One other study claims that the skin is a microbiota that plays an important role in the accumulation of microbes and so in turn affects body odor. So numerous recommendations have been cited with regards to this, and even with regards to washing your feet, the use of hyperallergenic microbial soaps. And it's also recommended that healthcare workers wash their hair every day. Now, we are Black people with Afro hair. Looking at those studies, I'm like, they wrote these studies for people of other ethnicities. So I went further to look to find another study that spoke to the care of Afro hair. And I found a study that spoke to the care of Afro hair for nurses, doctors, and other healthcare workers. And basically, NACWIT 2020 said that because Afro hair is so much more bothersome to care for, it is recommended that once a week is reasonable for washing one's hair. However, if it becomes contaminated or there's a probability that there was any microorganism exposure, your hair should be washed immediately. Other grooming initiatives have also been regulations in healthcare institutions where you're asked not to wear your hair down on your shoulders or in your face, or for men where facial hair is eliminated or groomed to an extent where it does not become a catalyst for the contracting or transmission of microorganisms. And other initiatives, my photos here on my slides are showing varied initiatives where the use of jewelry too, it is said, should be avoided. So I remember when I was going to nursing school, our student handbook says avoid wearing hand or wrist jewelry. I'm actually reading it because I took it out. Avoid wearing hand or wrist jewelry, fashionable or dangling earrings, except for one plain wedding band if you are married, and little sleeper earrings or knobs. And it was impressed upon us that by adhering to these regulations, that the probability of us contracting microorganisms from surfaces would be less, and it would be much more so efficient for hand care, washing your hands, to be much more effective if you do not have the unnecessarily jewelry and all those things on your person while in the healthcare setting, because they are catalyst for accumulation of microorganisms which can be transmitted. Also, with regards to the length of your uniform, how your uniform fits. So wear comfortable fitted uniform that allows free movement and prevent exposure of some body parts, and coverage that is adequate enough that in the event that there should be spillage, none will actually get on your skin. Wearing your sleeves above elbow length, or if you wear long sleeves whenever you are conducting any procedure or even hand hygiene procedures, pull your sleeve up above your elbow in order to prevent contamination of your clothing. So these good practices can prevent trans you from contracting microorganisms that might cause disease, as well as transferring microorganisms to another individual or to somewhere else. I don't know if any of you have seen, well, I know Mrs. Garrick's Lord, I've seen it, the advertisement where the nurse goes to work. She comes home from work in her uniform and all, obviously tired, sat in the sofa, was hugged by her child, was offered that, because I think it's a beverage, a Malta advertisement. She was given a Malta, and then I suppose to boost her energy. And then after that, she's sitting at the dining room table with her family in the same attire that supposedly she went to work with and came back in. And I am saying, I don't know where they got their information from, because they could not have consulted with a real nurse to put that advertisement together, because there is so much room for transmission of microorganisms. They're advertising a drink. We as nurses looking at that advertisement is seeing so much more than that. And so even with our home life, I know institutions now have been implementing this mandate where healthcare workers do not change out of their clothes before working and change out of their work clothes before leaving the institution. So they wear their mufti to work, they change in their work clothes before leaving work, they take the work clothes off, change back into their mufti before leaving the healthcare institution. And this was done with the mindset that this is another helpful way that we can prevent the transfer of microorganisms from our healthcare workers to anybody else out, especially when we leave our healthcare institutions out there, and also prevent us from transmitting microorganisms that we might have taken on our person when we do enter our healthcare settings. So, one thing I did even before COVID, because I was from my basic nursing training, it was so drilled into me not how dangerous some of these microorganisms can be and not to contract any of them. So I developed an initiative, and I know it's been practiced by a lot of nurses, where even if you do go home in your work attire, you remove it as quickly as or as soon as you possibly can. Me, I used to wear two layers, like I would have, and I still do sweat a lot. I sweat a lot. So I used to wear a short shorts or tights and a undershirt under my uniform. And when I got home, I would stand outside, I would take them off, put them in the plastic bag I leave outside, stick up in the grill, and take my shoes off, leave my shoes on the outside because my work shoes not coming into the house. And then, of course, even with laundering my work attire, I would not wash those clothes with any other clothes that I would when I'm doing laundry. And so sometimes these are the effective ways that we have to take into consideration when we are trying to prevent and working towards preventing and healthcare associated infections or infections that can be transmitted readily from one person to the next. One other good body hygiene practice that I must say I'm guilty of not practicing: foot care. So, one foot care consultant in Georgia, USA, states that she has experienced decades of ramifications from nurses neglecting that particular part of their body. And it is so uncanny because it's the part of the body we should be paying most attention to, because we are always on the go, always on our feet, always up and down. And then, even sometimes with the busy nature of our job, sometimes we go home, our legs hurt, our legs are swollen, but yet still we take little to no, or we give little or no priority time into proper food care. And so, even I noticed Registered Nurses Association of Ontario has rolled out in their best practice guidelines care tips for the feet. And they have stressed that some of these care tips are not just for our patients, they can be utilized by us as nurses as well. So, as nurses, we need to wear full shoes that fits well, shoes that supports our feet, that fit properly, not too tight and not too loose. Shoes that are not does not put you at risk for getting microorganisms onto your feet. So full shoes, not those with the holes. Yes, the material should be breathable so as not to have your feet being all sweaty in your shoes all day. And then when it gets moist, there's the catalyst again for microbe accumulation. And so both RNAO and this food care specialist were both advising that these that which I just mentioned be practiced by nurses. And of course, when we are doing foot cleaning, to wash our feet with soft cloth in warm water. Ensure that it is done on a daily basis. Dry between your toes with a soft cotton towel. Moisturize your feet with with unscented creams. Avoid putting it between your toes because of the whole sweating thing again, especially if you're going to put them back in your shoes. And treating ourselves to a massage or pedicure every now and again to promote good foot health, and of course to maintain proper body hygiene and also to prevent microorganism buildup and transmission from our feet. So they also included techniques on how to cut your nails, and of course the use of compression stockings to reduce foot swelling or foot pain and to give the nurse a little bit more comfort. However, it was highly suggested that in the event that the healthcare worker develops a foot problem that cannot be solved through any of these means, that they need to seek consultation from the expert foot care doctor so that interventions can be given in order to keep your feet healthy. And so because I know Mrs. Sweet will be looking at personal protective equipment, I am just going to say that one of the techniques that was a recommended strategy was that healthcare institutions, especially with regards to our nursing administrators and managers, that we keep continuous assessment and continuous training with regards to how we properly and appropriately use PPEs, how we put them on and take them off for effectiveness and to prevent contamination of ourselves and our surroundings, and how the purpose, how it reduces, as I said before, contamination. Training should also include other little tidbits when you are using your PPEs, such as keeping your hand away from your face, limiting the amount of surfaces you touch, and of course, removing your PPEs before you leave the work area. Sometimes, I remember Monday, Dr. White was saying sometimes you see the healthcare worker there in the PPE, touching every surface. They work in the intensive care unit. They cover shoes and the cap and the gloves outside in other common areas. And these are some practices that we unconsciously might do sometimes. And in the event that we see our colleagues or even ourselves, if we are not mindful, we might fall into that trap. Let us look out for each other and ensure that we remind each other of what are the proper strategies and what is expected of us with regard to activities with preventing contracting microorganisms and transferring microorganisms. Decontamination is also one of the strategies that they looked at, because I think there was some study with regards to decontamination in the Ebola, when the Ebola outbreak came a couple of years ago, and how inadequate decontamination had caused some of the healthcare workers to have contracted the disease. And so it was stated that it is also important that training our healthcare workers to to perform proper decontamination is also of utmost importance, because failure to decontaminate properly, especially with your equipments and your gears before doffing them, can cause widespread cross infection to patients and workers, putting us all at risk. And decontamination comes in the very high hallmark of hygiene care in the healthcare system, because not every situation requires you to decontaminate, especially when you're being sprayed down with antimicrobials and literally being washed off with soap and water. When you find yourself in that kind of a setting, the microorganism from which they hope to decontaminate you is highly dangerous. So, individuals too, not everybody, if you find yourself in a decontamination, a situation where you have to be decontaminated, you might be an expert in certain fields, because the newly graduate nurse, I would not put her in the isolation, in the unit where there's a person who has Ebola or one of those dangerously contagious diseases, because her expertise might not be as effective and efficient, and then you would not want to put the healthcare worker at risk. So the best possible competent, efficient person for that job would be even more so effective in preventing contamination and contracting the disease. So moving on to the other slide, I'm almost to the end. So I have some handy tips. I'm sure all of them I mentioned before. So handy tips: avoiding artificial nails, cutting your nails short, washing your hands frequently, using the 5 moments of hand hygiene to guide your hand hygiene practices, not wearing nail polish, not wearing jewelry on your hands. Also, the proper use of hand sanitizers or hand rubs, foams, dispensers, and of course, because you will frequently be washing your hands, the use of moisturizers, and then all of that which we touched on with regards to body hygiene that is pertinent to the healthcare worker. So, what we need to know is that hand hygiene practices for healthcare workers is very much so mandatory. I read here where it says every 2 years it's required, especially when you're doing induction and or induction training for new employees. But I think 2 years too long because I'm looking at every quarter, preferably, because we can and we really do need to limit the burden and utilize these techniques effectively so we can take care of our own health and even more so effectively take care of our patients and our clients without the probability of transmission of microorganisms and causing further infections. So these other slides are just a look at the initiative, the WHO initiative on Save Life, Clean Hands Saves Life, and it's a multimodal hand hygiene improvement strategy, and it's been tested across numerous healthcare facilities across the world. And the 5 moments of hand hygiene is very much being highlighted in this initiative. So they look at their various segments as to this initiative, where the resources should be available, because if the resources are not available to carry out these techniques, then we will forever be having the problem of transmission of diseases, especially in the healthcare setting. So, of course, sanitizers, soap and water should be available, education and health promotion of the techniques, research to evaluate and look at the effectiveness of how these techniques are being performed and how efficient they are, and if they're meeting the standards that are required. And of course, retrain, re educate, reminders, prompting the adherence on all scales for all healthcare workers in every kind of setting, and even the public as well. And of course, raising the awareness for a healthy, free, and hygiene efficient world where we no longer transmit dangerous microorganisms, even though we cannot get away from that, because, mind you, that is a part of life. However, how best we can assist in reducing these effects, let us do so. So, you can find all of these tools if you want to implement an action plan or reinforce the hand hygiene and body hygiene action plan that you already have in your healthcare institution. You can do so. You can go to the WHO website and the download the module for hand hygiene improvement, and then you will see these tools, and you can also decide which tool will be more effective to your institution and which one will your healthcare staff um, buy into more easily. And of course, the orange areas, to show you how global this initiative is. The orange areas are the countries that have already committed to this initiative and have been practicing it since 2005, and even before that. And so it is a global responsibility for us to keep our hands and our bodies clean and healthy, so we can stop the spread of microorganisms and the transfer of infections, which it's possible to prevent. So, ladies and gentlemen, thank you very much. Here are a list of my references. Thank you for paying attention, and have a blessed hand hygiene, body hygiene, effective rest of the afternoon. Bye bye.